welcome back. I just want to talk to you about getting started with your IVF cycle. Your doctor will give you a list of diagnostic tests that you need to complete. So I will go over what those tests may include, starting with your screening blood work. The screening blood work involves infectious disease screening. We want to make sure that you are immune to the chickenpox and the rubella virus. We do thyroid hormones. We do a complete blood count. We'll get a blood type on you. And then you have the option to do genetic screening to see if you're a carrier for any specific mutations or disorders that would be helpful to know ahead of time. The sperm source will also be advised to have infectious disease screening as well, and also they'll be advised to have genetic screening. Now, whenever you have genetic screening done, we will also recommend that you have genetic counseling done so you can review those results with a genetic counselor. If you are planning to carry the pregnancy, you will need a hysteroscopy, and a hysteroscopy is an evaluation of the uterine cavity. It's really important to have a hysteroscopy done before your transfer to make sure that you don't have any abnormalities within the uterine cavity that would prevent a pregnancy from implanting. It is done without anesthesia in our King of Prussia office as an outpatient procedure. You're fine to drive yourself to and from those appointments. It is typically done once you're done bleeding but before you ovulate, or if you're on birth control pills, it could be done while you're on birth control pills. The other test that you'll need if you're planning to carry a pregnancy is a mock transfer. A mock transfer is a practice transfer without the embryo. So the doctor will perform the mock transfer by putting a catheter through the cervix to measure the length of the uterus and the direction of the uterus before the actual transfer takes place, so that the physician that does your transfer can use that information so your transfer can be done as smoothly as possible. For patients who are providing the sperm, as well as the blood work that they need to have done, they'll also need a semen analysis, and this is so that our embryologist can assess the sperm before the day of the egg retrieval. If you're planning to use donor sperm, then the donor sperm needs to be selected, ordered, and delivered to our King of Prussia office, since that's where the embryology lab is, and that way it can be stored there until the day of the egg retrieval. Along with these diagnostic tests, there are other things that you should have done prior to the start of your IVF cycle. There are IVF consents that you'll need to have signed before the start of your injection medications, and those consents can be complete via DocuSign. They can be signed with a notary, or they can be signed at the RMA office with somebody there as a witness. These consents are dependent on your specific plan, so your nurse will go over what exact consents you'll need to complete. The other thing that needs to be done is your IVF medications need to be ordered. These are considered specialty medications, and a lot of times you can't get these at your local down the street pharmacy. If you have a pharmacy that your insurance mandates, then we'll need to send the prescription there. Sometimes it's a mail order pharmacy, so that means that the medications have to be delivered to you. We can help you figure out the timing of when they should be delivered based off of your cycle, so just ask us. If you don't have coverage for the medications and you're self-pay, you can certainly let us know, because there are pharmacies in the area that we can help you price the meds out with. I do want to give you a brief overview of the IVF cycle and the timeline. So how you get started is completing your diagnostics. Once that's complete, you'll start your medications and stimulate your ovaries, and that's called your stimulation phase. Now, once your ovaries are stimulated, you move on to your egg retrieval, and then you have embryo development in the embryology lab, followed by a frozen embryo transfer. Now, that typically does take place over the course of more than one menstrual cycle. During that stimulation phase, it's important to note that you need to be seen frequently for office visits. The reason for this is because you're on injectable medications, and those injectable medications are stimulating your follicles. So inside those follicles are eggs. Now, your doctor is going to select a dose that's specific to you and what you need to take on a daily basis, but we need to see you back frequently because there's a chance that you might need to increase or decrease those medications based off of your body's response. Now, those appointments are done in the morning. their blood work and ultrasound. The ultrasounds are vaginal ultrasounds because that allows us the best visualization of your ovaries. And anytime you're seen for an office visit, you'll get a callback or email that afternoon, whichever you prefer, with your results, your medication instructions, and when we need to see you back in. Now, your stimulation phase is about 8 to 12 days long, so just know that that is the time period where you need to come in most frequently. And towards the end of that phase, you may need to be seen every other day or on a daily basis. So now that you have an idea of how to get started, let's move on and we can talk about your cycle medications.